reason. See here, reason I'm telling you. Why Indian organs will not be given to foreigners? Please understand why. Because see, in India, actually already we have so much of poverty. People will start selling their organs for iPhone also. And so then, so after that, there will be what? More organ smuggling, organ trafficking, smuggling and all. Right now, see, but in some other countries, it is legal. When I talk about Sri Lanka, in Sri Lanka, it is legal. Sri Lankan organ can be given to foreigners, but in India, it is illegal. In India, it is illegal. As per law, it should not be done. ठीक है, याद रहेगा इतना? It should not be done. Yes, human organ smuggling is very common, no? Chalo, fine. My question is that organ transplantation can be done only at government hospital or private also? Both. Earlier, it was only at the government hospital. Earlier, only at the government hospital. But now at private also. Private also. Having said that, private hospital should have ICU. So remember here, organ transplantation, latest rule got updated in 2014. It is called a what? Transplantation of Human Organ Act 2014. So as per a new rule, yes, organ transplantation can be done at government hospital also, private hospital also. Private hospital should be having what? ICU facility. Okay, now see this question and try to answer. See this question. Okay, some of you are writing. RMP means registered medical practitioner. Registered medical practitioner. Dr. Rinusha, Dr. Sirajuddin, you are writing D. Dr. Stuti Saho, you are writing D. Dr. Saurabh also, you are writing D. A also. Okay. So basic, no volume ऐसे कैसे? Volume तो है ना? चलो ठीक है. Now understand. See, remember here, basically, suppose if there is one unconscious patient who is in the hospital now, who is admitted in emergency now, patient is about to die or almost dead. Actually, no one knows, but patient looks completely unconscious. If patient is brainstem dead or not, which doctor should never be invited? Which doctor should never be invited? And this is the question. So basically, we have to, first of all, there should be a doctor who can pronounce him dead, who can pronounce him brainstem dead. Brainstem dead, then only organ can be harvested. No. So ideally, who should be invited? Ideally, neurosurgeon, yes. Ideally, neurophysician, neurosurgeon. Ye nahi hai, then by the physician who was seeing the patient, the treating physician. Even registered medical practitioner in charge of the hospital, he can also declare a person as dead. Who should never be invited? Option number C. Suppose if I am a doctor who does I'm a urosurgeon. Suppose if I am urosurgeon, Dr. Saurabh. Suppose if I am urosurgeon and I'm going to perform what? Renal transplantation. My voice is clear to everyone. My voice is clear. Yes, no, doctor. See, because some of you are writing that voice is not clear. See, because 99% are writing that everything is clear. So I think you should also check internet. Right. Chalo, very good. Dekho, suppose if I am a neurosurgeon, I am having one patient to do renal transplantation. I need one kidney. My patient had a donor, but he was incompatible. Basically, patient does not have any donor now. So I have written one application in organ transplantation department of my hospital that I am having one patient waiting for one kidney. Whenever any patient gets admitted here, if there will be any priority, yes, I want one kidney for my patient. I want one kidney for my patient. My patient is also desperate. My my patient also wants to get one kidney as soon as possible. I also want to save my patient only. At this point, I will be a selfish doctor. I will be selfish. Why? Because I want to save my patient. I don't want to save your patient. I want to save my patient because if I perform renal transplantation, no, if I perform renal transplant, I will get money. I can save my patient. I will be having more name, more fame, more money. Simple. No, so I will be selfish doctor. So if you invite me to pronounce a person as brain dead, even if he is not brain dead, I will declare him. Kyun? Selfish. Easy to understand. That's why a doctor who belongs to organ transplantation department should never be invited for pronouncing a patient as brain dead. This is old question, 2 times एम्स question. एम्स question. समझ में आ गई बात? समझ में आ गई बात? याद रहेगा इसमें रूल? Yes, obviously this is against है ना, क्योंकि मैं selfish है, वो मरा नहीं भी तभी मैं उसको मार दूं, मैं बोला हाँ मर गया ये, organ निकालो चलो बस. Obviously wrong है, unethical, obviously. Okay, chalo fine. So basically it is, and so who will be called as, who will be, see, like when a person is alive, living donor. Living donor can be near relative. Near relative means what? Father, mother, son, uncle. Non-related means what? Some other person. Remember, if a near relative is there, only HOD can give these. Only HOD can give the permission. Yes, organ transplantation can be done. If a non-related donor is there, no. First of all, inquiry should be there. First of all, there should be inquiry. Okay, Dr. Sunil, RMP means registered medical practice. I am also an RMP. You will also be RMP, registered medical practitioner. Okay, non-related donor means what? Remember here. So basically a far person, maybe because of a smuggling, because it could be possible that that person is selling the organ, right? No. So remember here, for that, there should be inquiry first. There should be inquiry first. After that, permission should be given. What about this donor? Cadaveric donor means what? Dead donor. After brainstem death only. After brainstem death only. Okay. Swap transplantation means what? Swapping, you understand? Swapping matlab exchange. Idhar ka udhar exchange karna. Swapping. Suppose if there are two patients, patient A and patient B, both are waiting for the kidney. Okay. A has his own donor C. B has his own donor D. But see, what is the main problem here? No. A has his own donor, B has his own donor. Okay. But C is not compatible with A, D is not compatible with B. Basically, their recipients and donors, these are not compatible with each other. These are not compatible with each other. But when before organ transplantation, we have to do the compatibility testing. No, आप blood test करते हो, पूरा HLA test करते हो, HLA matching होना चाहिए ना. Ideally होना चाहिए ना, HLA matching होना चाहिए, blood test होना चाहिए. When everything is matching, when recipient and donor, when both are compatible, only then we can do organ transplantation. No, so A is not compatible with his donor, B is not compatible with his donor. But when examination got performed, A is compatible with the donor of B. B is compatible with the donor of C. As per a new rule, this exchanging, swap, तो सब जानते होगे, मूवी वगैरह देखा होगा, स्वैप करना, राइट है नहीं? सब एडल्ट हो. स्वैपिंग समझ में, इधर का उधर एक्सचेंज. क्वेश्चन है, स्वैप ट्रांसप्लांटेशन इज लीगली परमिटेड और नॉट? आंसर इज यस. Yes, it is legally permitted. Yes, it is legally permitted. याद रहेगा ऐसा पॉइंट? Yes, it is legally permitted. Easy to understand? I hope all these points are clear to all of you. Yes, it is legally permitted. डॉक्टर साजन पूछ रहे कौन सी मूवी है सर? इतने शरीफ तो हो नहीं तुम है. चलो ठीक है, आ जाओ. यूथेनेशिया का मतलब बोलो. यूथेनेशिया का मीनिंग बोलो. डॉक्टर साजन, एक मूवी आई थी अक्षय कुमार बॉबी देओल की, आई थी अजनबी, पुरानी मूवी थी, करीना कपूर बिपाशा बासु. अब देख लेना. ओके, यूथेनेशिया का मतलब क्या हुआ? Mercy killing. Okay, euthanasia means what? Mercy killing. Euthanasia means mercy killing or merciless killing? Mercy killing. Or you can say what? It is also called a painless death. It is also called as painless death. है ना? Painless death. Painless death. My question is that euthanasia is legally permitted in India or not? नहीं, सिर्फ एक आंसर करो, यस और नो. यस और नो. अगर ओवरऑल पूछा जाए यूथनेशिया इज लीगली परमिटेड इन इंडिया और नॉट, आंसर इज नो. आंसर इज नो. There are some rules we are going to discuss. If euthanasia is legally permitted or not in India, no. But Switzerland, some other countries, it is legal. In some other countries, it is legal. It is legal. Okay, in some kind. But in India, it is illegal. Question is, why you don't have right to die? You have right to live. You have right to live. Why don't you have right to die? Dr. Saurabh, yes, bolo. Why don't you have right to die? Yes, we are Indian property. We are Indian property. You cannot harm Indian properties. Human resource of India. We have right to live, but we don't have right to die. We don't have right to die. Very easy to understand, right? बिल्कुल हो सकता है. Don't die, right? Okay, fine. Now, please remember here, yes, ideally 99% euthanasia is illegal, but a type of euthanasia is there which is legally permitted in India. Can you answer me? Yes, please remember here that, yes, we are going to learn. Be here. See, चलो ठीक है, पहले इसको सीखते हैं, पहले समझते हैं. First of all, suppose the patient is in severe pain, patient is in excruciating pain, patient is having intolerable pain, patient is suffering from blood cancer or any cancer which he is not able to tolerate. So patient is asking, doctor, please kill me. Doctor, please kill me. I don't want to live. Okay, living is more painful. Please kill me. Please kill me. Doctor, please kill me. So क्या हो रहा है कि when patient is asking you, doctor, please kill me, you have given one injection. You gave one injection, you killed the patient. It is called as active euthanasia. Okay, which injection? Pentobarbital 2 to 10 gram. Death can happen within 15 to 30 minutes. Painful, painless death. Painless death. Okay. So remember here, basically, क्या कर रहा हूं मैं? Active euthanasia means what? When a doctor gives injection, of pentobarbital or any euthanasia drug, okay, doctor, after the patient will die, this is called active. 100% illegal. 100% illegal. Even if patient has given the consent, when patient has given the consent, doctor, please kill me, you killed him. It is called as what? Voluntary euthanasia. When doctor is not giving the consent, when doctor is like when patient is not giving the consent, but you are saying what? I'm giving you glucose. I'm giving you glucose, but you are giving what? Pentobarbital. You are giving what? Pentobarbital. You are giving pentobarbital. And a pentobarbital. Very easy, no? Then easy to समझ में आ रही बात ना? है ना? Very easy to understand. So that is called what? Involuntary. That is called what? Involuntary euthanasia. है ना? You are asking कि like if patient doesn't want to take any treatment, ठीक है, आप घर जाइए. No issues at all. ठीक है ना? Okay, fine. So basically remember here, if patient has not given you the consent and you are giving injection, this is equal to murder. Obviously, this is called what? Involuntary. Non-voluntary. Non-voluntary means what? Non-voluntary means what? When patient is not in the position to give any consent. When patient is not in the position to give any consent, either patient is in coma or if patient is a psychiatric case, right? Now if you are giving injection and you are going to kill, Right now, you are going to kill the patient. That is called a non-voluntary. I have taught you active, voluntary, involuntary, non-voluntary. So here only you can tell me which IPC defines murder. Can you write down? IPC number 300. IPC number 300, it defines murder. Where IPC number 300, it defines murder. And next, IPC number 302, it defines punishment for the murder. Punishment for the murder. Yaad rahega, it defines punishment for the murder. Very easy to understand. Punishment for the murder. Right? Okay, fine. So see, remember here. See, when I see here, separately in your notes, I have given you one chapter for IPCs. Please don't worry about that. With every chapter, I will keep on teaching you some few of the IPCs so that you can memorize. So selectively, you have to keep on writing. Please write down. IPC number 300 defines murder. 302 defines punishment for the murder. Punishment for the murder. Yaad rahega? Okay, fine. Now, what is the meaning of passive type of euthanasia? Active means you are giving injection, you are going to kill the patient. Passive means what? When patient is already on ventilator, patient is already on ventilator. Patient is on ventilator. Patient is on ventilator for last 7 days. Patient is on ventilator for last 7 days. 7 days se. Hai na? Now, as per your experience, you can easily understand that without mechanical support, without ventilator support, patient will not be able to survive. Patient will not be able to survive. Patient will not be able to survive. So first of all, you have to counsel the family members, because in government hospital, only 4 or 5 ventilators are there, but 100 patients are waiting. In the private hospital, see, every day for ventilator, 1 lakh rupees, 50,000 rupees, like that, very expensive, no? So you have to counsel the patient. You have to counsel the family members that it is useless to keep your patient on ventilator because he is already gone. His heart is beating only because of ventilator. His heart is beating only because of ventilator, right? No, only because of the ventilator. Very easy to understand. Dr. Jyoti, see, the voluntary is the type of active euthanasia. Voluntary, involuntary, non-voluntary. This is the type of active euthanasia, right? No, active means what? Where you are giving injection and you are going to kill the patient. And passive means what? You are supposed to counsel the family members that it is useless to keep him on ventilator because he is already gone. His heart is beating only because of what? Ventilator support, mechanical support. So please, remove him. So now you can detach the patient from ventilator. This is passive. This is legally permitted, right? This is legally permitted. Sarcoma patient withdrawn from life support, is it passive or non-voluntary? Only in coma is not the indication of death. I'm going to teach you, Dr. Shri Vishwa Siddhanathi, right? Wait. Only coma we cannot withdraw. Only coma. But yes, if family members, see, if family members, if they do not want to keep the patient on ventilator, yes, they can take the patient. That is a type of what? That is a type of the passive. In India, passive euthanasia is legally permitted. Passive means what? Detachment from mechanical support, detachment from ventilator support. Yaad rahega, detachment from ventilator support, detachment from ventilator support. Detachment from ventilator support. Very easy to understand, right? And that is called what? Passive euthanasia. Passive euthanasia. Now, without seeing the notes, all of you write down in chat box. I have taught you different types of euthanasia. Please write down. Doctor, you are asking. Dr. Akash, you are asking. Active with consent or without consent, always illegal. Always illegal. Okay. 5 types. Please write down. Mention karo. Active, passive. After that, voluntary, involuntary, non-voluntary. Please write down the name of euthanasia drug. Please write down the name of euthanasia drug. I have written here just now. Actually, many are there, but one we can learn, pentobarbital. How much is the dose? See, this is actually what barbiturate. So there will be respiratory depression. Patient will die peacefully. 2 to 10 gram. How much duration it will take to kill a person? 15 to 30 minutes. 15 to 30 minutes. Very good. Very good. Very good. Okay, fine. Chalo, theek hai. Now, death declaration, देखो, death declaration. See here, very, very important, death declaration. Death declaration is an art. देखो, only Dr. Shinit, remember here, active and the passive. Active separate, passive separate. These are the form of active. Active means what? When you are giving injection and you are going to kill the patient. That is active. Remaining, only withdrawing from the mechanical support, that is called a passive. Passive is legal. Otherwise, see, else all are illegal. That's it. Okay. Now, death declaration. Remember here, when a person is dying, डॉक्टर नजीब, इनवॉलेंट्री नॉन वॉलेंट्री में क्या फर्क है? इनवॉलेंट्री का मतलब क्या हुआ? पेशेंट हैज नॉट गिवन द कंसेंट. पेशेंट हैज नॉट गिवन द कंसेंट. Not given the consent. Patient doesn't want to die, but you are saying that I am giving you glucose and you have given pentobarbital. This is involuntary. Non-voluntary means what? Patient, either patient is in coma, patient is insane, या तो वो पागल है, यानी कि patient साइन नहीं कर सकता, patient is not able to give the consent. ठीक है ना? लेकिन फिर भी आप उसका वो करके आपने इंजेक्शन दे, that is non-voluntary. ठीक है ना? Remember here, only passive is illegal, remaining all other are illegal. For this, there will be charge of murder. That's it. Okay? चलो fine. Death declaration. अब देखो death declaration क्या है? देखो, मतलब when a person is dead, when a person is no more in your hospital, you have to declare the family members, no? You have to declare the family members, right? Okay, fine. तो क्या होता है कि देखो, जैसे study of death is called a what? Thanatology. तो यहीं पे एक और word लिख लो. All of you please write down. There is a word that is called a taphonomy. Taphonomy. लिख लो taphonomy. Write down. Taphonomy means what? See here. When I talk about thanatology, study of death. Taphonomy, study of process of decomposition. Study of process of decomposition of dead body. सड़ना गलना के स्टडी को कहते हैं टेफोनमी. टेफोनमी मींस स्टडी ऑफ प्रोसेस ऑफ decomposition of dead body. Decomposition of dead body. IPC 46 defines death of human being. Okay, so there are two types of death. One is called as a somatic death, another is called as a molecular death. Do you understand this? Somatic death का मतलब क्या होगा? Sudden stoppage of heart, sudden stoppage of heart, brain and lungs, HBL. Sudden stoppage of heart, brain and lungs. So basically there'll be what? Irreversible stoppage of heart, brain and lungs. These are the most important organs. This is called a what? Bishop's tripod of life. Bishop's tripod of life, right? Now, heart, brain and lungs. Okay, so this is called, so after a stoppage of blood circulation, patient will go into syncope. After a stoppage of brain function, patient will go into coma. After a stoppage of respiration, there will be asphyxia. So whenever there will be sudden stoppage of heart, brain and lungs, it is called a what? Somatic death or systemic death or clinical death. So basically please write down, these are what? Immediate signs. These are immediate signs of death. Immediate signs of death. This can happen within seconds. Now, please remember here that during this process, please, इसमें लिख लो, during this process, aerobic systems are shut down. Aerobic processes are gone. What does that mean? Means that tissues which could survive only with the help of oxygen, only because of oxygen, will be gone, shut down. But anaerobic processes will still be working. What does it mean? The tissues which can survive even in the absence of oxygen for a few minutes, okay, those organs will be alive. So during somatic death, if I ask you one question, do you think all organs are dead? Do you think so? All organs are dead? No. By heart, brain, lungs got stopped. Fine. Stop ho gaya. But the question is that, do you think the all organs are dead? No, all organs are not dead. All organs are not dead. So what does it mean? Suppose if I'm going to administer meiotic drug, meiotic drug or mydriatic drug in eyes. Do you think eyes will respond? Yes, eyes will respond. Suppose if I am going to shift the patient to ventilator, do you think so? Do you think so? Muscles will also be reacting? Yes, muscles will respond. Muscles will respond. So during somatic death, anaerobic processes are still alive. It will take heart. It will take 45 minutes for the heart. Even after death, heart muscles will be alive for 45 minutes. Even after death, the renal part, the kidney will be alive for 1 hour. Liver will be alive for 15 minutes. What does it mean? These tissues can survive even in the absence of oxygen for a few minutes, right? Okay, fine. So when there is somatic death, if you have to declare a person as dead, no. You have to show ECG. You have to show flat ECG. This is the rule. This is the rule. देखो इंडिया में क्या होता है ना, डेथ डिक्लेरेशन आई वुड से दिस इज एन आर्ट. Declaring a person as a dead is an art. Death declaration. मतलब क्या हुआ था मेरे साथ ना, फर्स्ट टाइम विद मी व्हेन माय सीनियर्स आस्क्ड मी, गो नदीम, गो एंड डिक्लेयर अ पर्सन एज डेड, है ना. तो आई सेड सर हाउ टू डिक्लेयर. माय सीनियर्स आस्क्ड मी, यू आर डॉक्टर राइट, गो जाओ जाके डिक्लेयर करके आओ. इसमें क्या पूछना, कौन सा बड़ा लॉजिक है. गो एंड इन्फॉर्म द फैमिली मेंबर दैट देयर पेशेंट इज नो मोर. आई सेड यार ऐसे बोल रहे जैसे संतरा बेचना. जा जा, संतरा है क्या है. आई आस्क्ड द नर्स, सिस्टर जी हाउ टू डिक्लेयर अ पर्सन एज डेड. सिस्टर जो नर्सेस होती है ना, नर्सेस है ना, तो वो आके बोली सर लुक फॉर मेल एंड फीमेल फर्स्ट एंड अप्रोच ओनली फीमेल्स. गो अप्रोच ओनली फीमेल्स. बेसिकली क्या होगा ना, यू विल सी दैट स्पेशली इन इंडियन हॉस्पिटल ऑब्वियसली सपोज इफ वन पेशेंट इज एडमिटेड, after out of the hospital 15-20 people will be waiting. 15-20 people will be waiting there. Attendance 15-20 people will be waiting. ठीक है. क्या होगा कि अगर जाकर के बोलो ना, if you are going to ask them your patient needs blood, everyone will run away. All of them will run away. But at least there will be one man. After that he will come, हाँ मैं दूंगा, I will give my blood. But his wife will stop. No, you don't go. Why? You will become weak. ऐसा वाला नहीं, वैसा वाला. Easy to understand. तो नहीं होगा है. Easy to understand. ठीक है. तो बेसिकली यू शुड नो हाउ टू डिक्लेयर अ पर्सन एज ए डेड, ब्रेन डेड या डेड जो है ना, डेड. हाउ टू डिक्लेयर अ पर्सन एज ए डेड. ठीक है, चलो फाइन. तो देखो नाउ इफ आई एम गोइंग टू डिक्लेयर अ पर्सन एज ब्रेन डेड, okay, I could see that one group of females, one group of male at one corner. I will be approaching female first of all. Why? देखो females are soft, males are very aggressive. मेल्स आर अग्रेसिव. देख अगर उसको डिक्लेयर करोगे ना, सपोज इफ यू आर गोइंग टू डिक्लेयर दैट योर पेशेंट इज नो मोर, मेल्स विल गेट अग्रेसिव एंड दे विल स्टार्ट बीटिंग द डॉक्टर इटसेल्फ. उनको क्या लगता है, डॉक्टर्स हैव किल्ड माय पेशेंट. उनको यही लगता है, राइट ना. अरे नहीं, डिक्लेयर अ पर्सन एज ए डेड मीन्स यू हैव टू इन्फॉर्म द फैमिली मेंबर्स. हाउ यू आर गोइंग टू इन्फॉर्म द फैमिली मेंबर्स, डॉक्टर मंजूर एंड डॉक्टर हरीश. ठीक है ना. सो बेसिकली I am going to approach female gallery, है ना, female gathering के पास जाऊंगा and I will start see. You also make your face that you are also very sad. You are also very sad. Okay. You will start saying what, है ना, कि we already, है ना, we already have explained you the prognosis. Actually we did our best, but you know we could not save your patient. I'm really sorry for your loss. ठीक है ना. Easy to understand. Right? Easy to understand. So basically, when you will be explaining like this, no, okay, we could not save your patient. While explaining it, please move backward. And I explain you like right now. बोलते बोलते पीछे जाने का, रुकने का नहीं. Don't stop there. Just inform and go back. सही है, एक्सप्लेन कर दिया, ठीक है. बट रूल इज व्हाट, देखो रूल क्या है, whenever you are declaring it, no, you have to show flat ECG. You have to show flat ECG. Flat ECG. I had a junior in Hyderabad only. So there was a political patient. है ना, देयर वाज अ पॉलिटिकल पेशेंट. नहीं, नर्स ने बताया, मैं जाके बोल दिया यार अपना वो हिसाब से, मर्द औरत को देख कर फिर जाके बोलिए काफी. तो क्या हुआ कि हॉस्पिटल में या इन हैदराबाद ओनली, नो, देयर वाज वन जूनियर, राइट, नो, देयर वाज वन जूनियर. सो बेसिकली one political patient who was actually completely unconscious. So my junior, like, he started doing CPR. He started doing what? CPR. But okay, see, so he did CPR for 15-20 minutes, but he could not save the patient. He could not save the patient. He could not save the patient. Okay, fine now. तो उसमें क्या हुआ कि like, see, because he was a political patient, he was doing CPR. He could see that out of the main door, at the window, 15-20 men were standing. Men, obviously political patient था, political patient था. So he was looking inside. अब ये था इसको, because he had to declare him dead, so he wanted to get ECG paper. So when he जो ECG machine देखा, you would have seen ECG machine, a small machine, but inside there'll be a paper roll. Paper roll will be there. When you are going to apply leads here, you are going to press the button. After that, that paper will be coming out. No, ऐसा ही होता ना, देखा ना ECG machine, देखा ना. Okay. So when he applied the leads, no. After that, when he pressed inside, there was no paper roll. Inside, there was no paper roll. He made a phone call to nurse. Sister ji, paper roll bhejo jaldi, send the paper roll, because I have to declare a person as brain dead. Okay, see, he is actually dead. So I have to show ECG. Nurse said, sir, ECG paper is not available. Please wait. Okay, अरे sister ji, jaldi bhejo. Okay, you get it something. Okay. So after nurse said, it will take half an hour. Minimum half an hour. I cannot get ECG paper. Now, when he was on the phone, see, other people who were standing at the backside, no, they understood something is fishy inside. After that, they opened the door, they pushed the door, they came inside. So when they came inside, again he started doing CPR. ऐसे करके CPR देना शुरू कर दिया भाई ने, है ना. So now ऐसे CPR देते थे, when more, all 15-20 people were there, no. When he started giving CPR, after that, I'm sorry, could not save your patient. Really sorry. तो जब वो लोग बोला, अरे ऐसे कैसे विदाउट ECG, ऐसे कैसे विदाउट ECG आप कैसे बोल सकते हो? बोले no. Problem is that when a person is dead, even ECG machine can sense it, and ECG machine does not eject any paper. देखो नॉन मेडिकोस है ना यार, वो थोड़ा ना समझेंगे यार, वो नॉन मेडिकोस. So next day his HOD asked him, how could you declare a person without ECG? You should have waited there. No? So he said, sir, if I would have waited there, they would have made me paper roll and thrown me a dustbin. Right? तो कभी कभी थोड़ा सा ना दिमाग चलना चाहिए, right? Presence of mind. How to save yourself, right? चलो ठीक है. So ECG is mandated. So can you tell me somatic death का definition बोलो? Somatic death का definition बोलो. Sudden stoppage of क्या? Short form में लिखो आप लोग. Write down in chat box. Short form. Yes, sudden stoppage of heart, brain, and lungs. है ना? Sudden stoppage of heart, brain, and lungs. Heart, brain, and lungs. है ना? Okay, this is called what? What kind of क्या था? Bishops क्या था ये? Bishops. Yes, these are what? Immediate signs. This is called what? Bishops tripod of life. So during somatic death, only aerobic processes are gone, or anaerobic also gone? Only aerobic, right? Only aerobic. Okay, fine. Very easy to understand. So flat ECG, flat EEG, there will be what? Complete stoppage of lungs. There will be complete stoppage of lungs, right? Very easy to understand. So during aerobic process, during actually somatic death, pupils will respond, muscles will respond. Very easy to understand. Now, What are the clinical criteria to diagnose brain death? What are the clinical criteria to diagnose brain death? Very, very easy to understand, very, very important to understand. See here, basically now you should learn, see, because what you are going to learn here, this will help you in hospital also. Clinical criteria to diagnose brain death. Brain death. First of all, person should be in coma. Coma. After that, absence, see, there should be what? Absence of brainstem reflexes. And then there should be signs of the brainstem destruction. First of all, let's understand one by one, one by one. See, what is the meaning of absence of, see, what is the meaning of reflex, brainstem reflexes? One is called a pupillary reflex. Pupillary reflex. See, when you are going to project the torchlight in eyes, there will be constriction of pupil or not? Yes, there will be constriction. Okay, this is called a pupillary reflex. If there is no suppose if there is no pupillary constriction, means absence of pupillary reflex. Next is called as corneal reflex. Whenever you are going to touch the white part with any foreign object, obviously after that there will be blinking. No, there will be blinking. Right now, this is called a corneal reflex. Please write down. Corneal reflex is also called as a blinking reflex. क्या बोलेंगे इसको? Blinking reflex. It is also called as blinking reflex. It is also called a blinking reflex. Blinking reflex. है ना? Whenever you are going to touch the white part with any foreign object, there will be blinking. Pharyngeal reflex क्या होता है? You insert any foreign object in the mouth. Or like a spatula. Spatula पता होता है ना? Wooden होता है spatula. You insert it inside. And after that you touch the most posterior part of hard palate. Whenever you are going to touch the most posterior part of the hard palate, suddenly after that there'll be what? Neck constriction. It is called a pharyngeal reflex, also called as a gag reflex. Gag reflex. Pharyngeal reflex or gag reflex. Gag reflex. Next is what? Tracheal reflex. When you intubate a person up to the lower part of the windpipe here now. So there will be receptors for cough. There will be receptors for cough. Okay. So whenever you are intubating, whenever you are going to insert a tube, there will be coughing. There will be coughing. If there is no coughing, it means what? This reflex is absent. This is called a what? Tracheal reflex. Now, what about oculovestibular reflex? Oculovestibular reflex. See here, anyone who is nearby you, hold the head like this. After that, move from left to right, left to right, move from left to right, left to right. I say, see here, when I am looking at you, so even if you move from left to right, eyeball is fixed or not? Eyeball is fixed, fixed eyeball. This is natural. This is called a oculovestibular, also called a doll's eye reflex, also called as doll's eye reflex. If these reflexes are absent, you can say about absence of brainstem reflexes. Without seeing the notes, bolo picture number 1, which reflex is this? Picture number 1, bolo. Which reflex is this? Very good. Picture number 1 is what? Corneal reflex. Picture number 2, bolo. Picture number 2, bolo. Okay. Picture number 2 is what? Pupillary reflex. ये बताओ picture number 3 बोलो. Picture number 3. Gag reflex or pharyngeal reflex. Pharyngeal. Okay. Picture number 4 बोलो. Doll's eye reflex, also called as oculovestibular reflex. Oculovestibular reflex. Very good. ये बताना, ये पिक्चर नंबर 5 बोलो क्या है? पिक्चर नंबर 5 tracheal reflex, right? Tracheal reflex. Very good. So now you can recognize a 5 brainstem reflex. If these reflexes are absent, it means person is no more. Person is brainstem dead. Okay. Signs of brainstem destruction. Brainstem destruction. क्या होगा? Like apnea. See, when I talk about the brainstem, no, इसमें ये जो दिख रहा है, the highlighted part which you can see, है ना, which you can see here. See the highlighted part which you can see here. This is called a brainstem. ठीक है ना? This is called a what? Brainstem. So I'm talking about this only. When there'll be what 100% stoppage of brainstem, then you can say brainstem dead, brainstem dead. Brainstem destruction ke apnea, pulse rate invariant, okay, breathing issues means almost gone. Unresponsiveness to atropine. When do you give atropine, by the way? When do you give atropine? When do you give atropine? Why do you give atropine? Why? Yes, when there is what? A low heart rate. When there is low heart rate. Whenever there is bradycardia. Whenever there is bradycardia, low heart rate. And for this, you are giving what? Atropine. Basically, whenever you will give injection of atropine, heart rate will increase. If you give injection of atropine, heart rate will increase. Simple hai. If there is bradycardia, give atropine injection, heart rate will increase. So remember here, even if you are giving atropine, but there is no response in heart rate. When there is what? No response in heart rate. Anyone who does not know any point, please keep on writing. So even if you are giving injection of atropine, there is no response. There is no change in heart rate. Easy to understand. So if you can see all these points, you can say that brainstem is dead. Last ditch stand. Dr. Ashwin, I did not understand your question. Okay, fine. Now, see, what about how will you declare that if patient is in the coma? How will you understand if patient is in coma? Patient is in coma. How will you understand that? Remember here, do we have any examination to declare a person in coma? Do we have any examination? GCS, Dr. Akshar, very good. GCS, that is called what? Glasgow Coma Scale. Yes, this is called what? Very good. Okay, Dr. Shehzadi, I will explain that again. Don't worry about those reflexes. Okay, I will explain that. Okay, so Glasgow Coma Scale. Now we are going to learn what? Glasgow. लिख लो ये word. Glasgow Coma Scale. Glasgow Coma Scale. Glasgow Coma Scale. Very, very important. Glasgow Coma Scale. Here we have to check what? Eye response. Okay. Verbal response. Motor response. After road traffic accident, if a patient is admitted in emergency department, ठीक है, see ये बताओ, suppose if I'm going to check like this, okay, Dr. Shehzadi, now you focus. See, देखो, now if I'm holding the head like this and I'm moving from left to right, eyeball is fixed or not? Eyeball is fixed or not? Which reflex is this? Which reflex is this? Which reflex is this? This one. It is called a what? See here. See, even if I'm moving from left to right, I will keep on looking at you only. Now, this is called a word oculovestibular reflex. Oculovestibular, which is also called as doll's eye. समझ में आ गई बात ना? Doll's eye. All these reflexes you are supposed to memorize. Okay? ठीक है. Chalo, fine. After road traffic accident, if a patient got admitted in my hospital, I can see that patient is completely unconscious. Patient is unconscious. So now I want to check. See, a patient is unconscious or somewhat unconscious. ठीक है ना? Somewhat unconscious. Okay, fine. Now, first of all, I would like to check the eye response. If patient is having mental confusion like that. So if patient is in supine position, patient is on a stretcher. If I can see the eyes of the patient, if he can open his eyes spontaneously, Dr. Mahima, newborn reflexes are different. I'm talking about dead body. Almost a person when is about to dead, a brainstem dead. Right now, okay, Dr. Mahima, reflexes of newborn is completely different. 100% different. That you'll be learning in the pediatrics. Okay, so see here, if eyes, see here, suppose if patient can open his eyes spontaneously, I will give him maximum score 4. Maximum score 4. Okay, see here, suppose if patient is Suppose the patient is in supine position. If patient is in supine position, patient has closed his eyes. When I'm asking him, hey, open your eyes. Open your eyes. After my instruction, if patient is opening the eyes, how much score I will give? Only 3. Only 3. Okay. Now, even when I'm asking the patient, hey, open your eyes, he's not opening. I can see a wound over his shoulder. See, when I'm going to touch his wound like this, after there is a kaun hai bhai? After the pain, if he is opening, then I will give him only 2 marks. Even after the pain, if he is not opening, basically no response at all, I will give only 1 mark. I will give only 1 mark. Okay, 1 mark. Easy to understand? Fine. Okay, fine. Chalo, zara ek baar likho. All of you, please write down in chat box. See, patient can open his eyes spontaneously. How much score you will give? 4. Very good, Dr. Jennifer. Very good, Dr. Muzaffar. Okay, fine. Suppose the patient can open the eyes after my instruction, after my speech. 3. After the pain, 2. No response at all. 1. So maximum, how much score you have given here? Maximum. How much score is maximum here? Maximum is 4. How much is the minimum? 1. Now, verbal response. Verbal response. Suppose say a patient can speak or not. When patient is speaking, patient looks very comfortable. Patient is completely oriented to time, place, and person. Basically, patient knows where he is standing, with whom he is speaking, right now. So patient is completely oriented to time, place, and person. Patient is right, completely oriented to time, place, and person, right? Okay.